Go ahead.
Hi, good evening. Welcome and thank you for joining us for Senator Brooks' informational webinar on safety and accessibility of COVID-19 vaccines. My name is Lucia Martinez. I'm the Director of Constituent Services for Senator Brooks. This evening, we will have an important conversation with medical professionals, local officials, and community members regarding COVID-19 vaccines. Again, welcome and thank you for joining us. This evening, we will be having offering Spanish translation for this event. Shortly, we will activate the Zoom interpretation features and you will see a button that will pop up that you will be able to hear this in Spanish. If you would like to listen to this presentation in Spanish, please click on the interpretation button and choose Spanish. If you would like to hear this event in English, you do not need to do anything. I'm going to ask our interpreters to please translate. Thank you.
Aquellos que deseen escuchar esta presentación en español pueden oprimir el botón que queda al fondo de su pantalla para interpretación simultánea de esta presentación y escojan el idioma español. Gracias.
Thank you. So we have 3 applications in our Zoom this evening. We have the chat application. We will be putting different links and information in the chat application. And we also have the Q&A. Please submit questions that you have. At the end of the presentation, our panelist guest speaker will be able to answer those questions for you. And if you're having difficulty with audio or video, you could please use the raise hand application on the screen. Now, today's agenda, we have prepared for you a presentation by Dr. Andrew Clare. We also will be having a conversation with our guest speakers. And we're also going to be having information about New York State vaccine distribution plan, vaccine tracker, and vaccine appointments and eligibilities. And we're going to have a question and answer session at the end. And then we hopefully will continue from there. And right now, I would like to introduce to you, we have myself, Lucia Martinez, from Senator Brooks' staff. We have Joe Agavino, Director of Communications, and we have Melody Janza. She's the External Relation Associate. And we have our wonderful, amazing community outreach group, which is Jessica Fernandez. She is Partnership Specialist in Community Engagement. We also have Daphne Irizarry. She is the President of LILTA, Long Island Latino Teachers Association. And we also have Maria Jordan Awalam. She is a Freeport District Board of Trustees. Thank you so much for all your dedication. We really are grateful for your time, commitment, and thank you and welcome. At this moment, I would love to introduce to you our remarkable guest speakers this evening. We have Stephen Jordan. He's a critical care nurse from Maine. We also have Dr. Andrew Clare. He is a pharmaceutical consultant. We have Dr. Gerson Piguet. He is from Suffolk County Department of Health Services Commissioner. We have Maria Jordan Awalam. She is also a Freeport resident. And Dr. Joan Sazzo. He is the board member of the Nassau County Department of Health, Medical Research Corp, Medical Director of Nassau County, and Medical Director of East Meadow for the Fire Department, and General Pediatrician. We are privileged and we're honored to have you here this evening with us. Thank you for being here and taking time from your busy schedule to join us. At this moment, it's my privilege and honor also to introduce to you our 8th District Senate, Senator John Brooks. Senator Brooks, we are so grateful. Thank you for making this webinar available. Thank you for your support. Thank you for really making this informative webinar available to the community during this critical time. Senator, I welcome you and thank you for being here as well.
Thank you, Lucia. These, I think we all realize, have been trying times for the last year. We've been dealing with this pandemic here in New York and across the nation, in fact, across the world. It is fortunate now that we've reached a point that there is vaccines available and we're starting to see distributions of those. The distribution has been a little slower than we wanted. We had some issues on a national and I guess even worldwide basis of getting the number of vaccines produced, but we're starting to get that operation under a little better control than we had before. This evening, you're going to be giving some critical information concerning the vaccine, how it works, and the safety of it. I myself had an opportunity about a week and a half ago to get. You see how badly I needed a haircut there. I'm among other things, I'm still an active duty firefighter and first responder, and we got our vaccines, the first vaccine at least, about a week and a half ago, and we're going back on the 18th on the second vaccine. It's critical that we all get the vaccines, that we feel comfortable with those vaccines and the effectiveness of those vaccines. So this program tonight, in part, is to make sure you're comfortable and understand, and if you have some questions on the vaccine, you can answer them. We all know our world is different right now. Tonight, we're all together on a Zoom webinar. We've been able to do several of these. Our workday has changed. This is my fourth Zoom so far today. I have to leave this one shortly to go to another one on another issue. But it's important we get information out to you. There's a number of experts here tonight that can give you information and answer questions. And our objective is to make sure you know how you can gain access to getting these vaccines. If you have concerns about some of the issues, they can be answered today. Collectively, we have done a good job in many aspects of people following the rules in terms of the use of masks and social distancing. We know we've been exceptionally successful, really, on our educational school systems.
Mucho éxito con las escuelas y distribuyendo la información.
We in the educational systems.
También en el sistema educacional.
We've gotten a little drift here from the one line over, and the incidents in the school systems have been well. The president has set an objective of getting a large number of vaccines in the first 100 days, and we are seeing progress there. So I thank all of our guests tonight. This is such a critical issue. It's so important you know how and where you can get these vaccines. Any uncertainties you may have can be answered. And we know these vaccines have been successful. And in bruising it down, the more vaccines we get, the faster we can make this terrible pandemic, if you will, become a thing of the past. But we've got to remember and pay attention. We know this virus has been able to make a number of changes in how the disease is functioning in different areas of the world, and it shows us that we're up against a pretty significant enemy right now. But our scientists and medical people around the world have done a good job battling this, finding the vaccines, and I know all of us are trying to get a vaccine as soon as possible. And again, our purpose today is to tell you how, where, and when as best we can, and then pay attention to the production of those vaccines. So again, I really appreciate the work, everybody that will be participating in this webinar tonight has done. The folks in my staff really work hard to get information out to you on the critical issues. They've done a wonderful job with all of these webinars. We've had significant number of people listen in, and we've had some wonderful experts, and tonight is no exception. You have some great experts. I hope to try to get back to this call, this webinar before the night is out, but I do have to run to another Zoom right now, and then I'm going to try to get back. But we really want to make sure you guys have access to these vaccines. We want to make sure you're safe and that you're informed, and collectively we're all working to make this this terrible pandemic become a thing of the past. Certainly on the other side of the thing, legislatively, we're actively working on ways to provide some financial assistance and recovery and other things associated with this pandemic. That's not for this particular meeting, but just you should know that most of our sessions right now actually are done by Zoom, but there is tremendous effort going into recognizing all of the challenges this pandemic has brought to you, from putting food on the table to paying your rent to maintaining a job. And we are working, and it looks like the Congress is getting closer to providing some meaningful financial support as well. So we'll as things change in that direction, we'll be having some webinars to give you information on programs that are coming down. So I say to all of you, thank you so very much. I do hope to be back later, but tonight you're going to get some critical information by some wonderful people, and hopefully have an opportunity to ask any questions and get the information you need. So to all of those participating and our experts, I again say thank you very much. I hope to get back, but I know that you're dealing with some outstanding people who are going to be able to give you all of the information you need. And if for some reason there's something we can't get to you, we'll make sure we get that information to you as soon as possible. So again, to everybody, thank you. I wish all of you the best of health in these trying times. And, you know, we're going to get through this. We're going to get this through together, and make sure you wear your mask. Thanks. Good night.
Thank you so much, Senator Brooks. We really appreciate your time, your dedication, and really making a difference in our community. Thank you for the hard work you do.
Thank you, Lucia.
Absolutely. At this moment, it's an honor and a privilege to introduce to you our extraordinary special guest speakers. We are so grateful you took some time out of your busy schedule to be here with us this evening. I would like to introduce to you Stephen Jordan. Stephen Jordan is a critical care nurse from Maine. And just a little bit about his background. He is a registered nurse, and he has been serving on the front lines during this pandemic and is joining us from Maine, like I mentioned. Stephen, if you could please say hello, and if you'd like to take a brief remark to say hello.
Hi, everyone. Like Lucia said, I'm a registered nurse from Maine. I do have some ties to Long Island. I was an EMT in Freeport, New York as well, around 2012, 2013. And then grew up on Long Island, came up to New Hampshire, Maine to become a nurse. And I've been here for the past 5 years. So I've been an ICU nurse for the past 5 years, and it's definitely different this past year compared to what it's been. Thanks for having me.
Thank you for being us and joining us. Thank you so much. At this moment, I would like to introduce to you Dr. Andrew Clare. Dr. Andrew Clare, he is a PhD pharmacologist and past member for 37 years in the pharmaceutical industry. Dr. Clare has authored and co-authored over 140 scientific papers published in peer-reviewed medical journals. Dr. Clare was an adjunct professor at St. John's University and Temple University. He currently provides lectures to medical school students on pharmaceutical medicine. In addition, he frequently lectures in the Shoreham Wading River School Districts on the tragedy of tobacco and vaping, and serves as the panel member on the radio program to address the dangers of steroids abuse in athletes. Most recently, Dr. Claire has been providing presentations at public libraries across Long Island on the science of COVID-19, just the facts. Thank you so much, Dr. Andrew, for Claire, for taking your time to be here with us. If you could please, take a moment to say hello and an opening remark as well. Thank you.
Yeah, thank you so much for having me. And I hope, can you hear me? Yeah, good. Yeah, it is my privilege, and I feel very honored to be with this team tonight. Special thank you, obviously, to Senator Brooks and your really esteemed staff who have been so helpful to me in terms of getting me here tonight. I really, really appreciate this. I'm a Long Islander, born and bred here, grew up in Manhasset, presently live with my wife in Shoreham Wading River. My 3 children are all in New York City, all employed and healthy, thank goodness. Like I said, I'm very, very happy to join tonight and looking forward to helping everyone understand a bit more about COVID-19 and vaccines. Thank you very much.
Thank you, Dr. Claire. Thank you for being here with us tonight. At this moment, I'd like to introduce to you Dr. Gregson Pigot. Thank you so much for being here. Dr. Pigot, he is the Suffolk County Department of Health Service Commissioner. Dr. Gregson Pigot serves as the Commissioner for Suffolk County Department of Health Services, where along with division directors, office staff, and bureau chiefs, has taken a purposeful, proactive role in Suffolk County to improve the health and well-being of 1.5 million residents. The department and Dr. Pigot works to ensure that the department programs are sustainable and efficient. Thank you so much for being here, Dr. Pigot. If you could please say a hello and an opening remark as well.
All right, good evening to all. I've been with Suffolk County now since June of 2009. Started out as the Director of the Office of Minority Health for Suffolk County. Later picked up titles of System Emergency Medical Services Medical Director for Suffolk County, working with our EMTs and paramedics in the county, and also as a provider in one of our 4 methadone clinics in Suffolk County, and being in the front lines of the opioid pandemic here in Suffolk County as well. I was promoted to Health Commissioner February 28th of 2020. And at the time, we were following travelers from China and checking in on their symptoms for 14 days as they traveled and lived in Suffolk County. And then lo and behold, we found out the virus was already around here and circulating. And we first found out that we had virus in Suffolk County on Sunday, March 8th. So that's just about 10 days after I became, 8 days after I became commissioner. So that was a kind of a rude awakening. And sort of like after you finish beginner swim lessons, they just throw you right into the deep end of the pool and tell you to figure it out. So it's been a fun, it's going to be coming up in a year now, towards the end of this month. So I'm excited because we are on the offensive side of the pandemic, if you will. We've been playing defense from the beginning in terms of just investigating cases, people that test positive, and really encouraging contact tracing and encouraging people to quarantine. But now we have vaccines and we could start playing a little offense. So that's been an exciting thing that we've been doing, and we're part of the vaccination efforts here for our county. So thank you for inviting me this evening.
Thank you for joining us. Really appreciate your time. At this moment, I'd like to introduce to you Maria Jorna-Wallum. She is a Freeport community member, and she's also Senator Brooks' Hispanic work group as well. And she is also a Freeport District Board Trustee. Maria, thank you for joining us. And again, if you could please say hello and an opening remark as well. Thank you for being here.
Thank you, Lucia. And I'm happy to be on the other side today and on the panel. And it's been great, being part of Senator Brooks' community work group and just continuing to have these critical conversations. It's so important. So I'm thankful that we continue to do it. And I'm thankful to Senator Brooks' office for always thinking of the community and educating them as much as we can. So thank you.
Thank you for joining us. And at this moment, I would like to introduce to you Dr. Joan Sazzo. He is a board member at the Nassau County Department of Health, the Nassau County Medical Director at the Medical Reserve Corps, and Medical Director at the East Meadow Fire Department, and a general pediatrician serving Long Island. Thank you again for being here and taking time from your busy schedule. If you could
Thank you very much, and it's an honor to be here, and thanks Senator Brooks for his getting these webinars out. As we say, knowledge is power. I've been born and raised on Long Island, and I've been involved in both pediatrics and EMS for the last 30 years, serving the Department of Health also for about the last 6 years. This has been a rough ride for everybody, and I think getting these webinars out again is critical. I have the unique perspective of being both a general pediatrician, seeing this from the children's side, and also working frontline EMS. And how it's affected people tragically and in the community. So I think doing this is a wonderful thing. And again, I'm honored to be here. Thank you very much.
Wonderful. Thank you again, all of you, for being here. It's really appreciated. At this moment, I would like to turn this to Dr. Andrew Clare. He is going to be presenting for us. Dr. Clare, it's your time. Thank you.
Thank you very much. Well, good evening. And again, to Senator Brooks and his staff, as I said, it's a privilege and certainly an honor to be with you tonight. I was asked to make a short presentation on several issues that were presented to me, and so I will proceed. I do want to mention that the purpose of my presentation is for educational purpose only, and I don't want it to replace independent professional judgment or be used as a substitute for discussions with your healthcare professional. When I give a talk like this, I think it's very important that we keep in mind the lives that have been lost so far to this brutal pandemic. As of this morning, 2.2 million deaths around the globe and 450,000 deaths as well in the US. These numbers are mind-boggling and they're catastrophic. And you can sometimes lose sight of the fact that these are single individuals who leave behind families, friends, relatives, brother, sister. It is a tragedy of immense proportion, and our thoughts and prayers go out to them every single day. My agenda is here. It's very ambitious, but let's get right into the very first part of it, which is basic information about vaccines. They really are a major success story of modern medicine. They've wiped out several diseases, including smallpox, and greatly reduced other diseases as well. What they do is they mimic the infectious virus that causes disease by stimulating the immune system. So you basically are producing antibodies without being exposed to the actual disease. You actually don't get the disease, but you still get those antibodies. Those antibodies develop, they give you immunity without, as I said, getting the disease first. And vaccines traditionally have contained the actual agent, either attenuated or actually killed, to produce those antibodies. But now we have a new technology in play through the Moderna and Pfizer vaccine. I want to talk about that with you tonight. There are many vaccines that are now available, 5 to be specific. And the 2 that are currently approved are the Pfizer and Moderna vaccines. And they take advantage of what's known as messenger RNA technology. And I'll spend time with you on that in a moment. They are astoundingly and amazingly, spectacularly effective at 95 and 94% effective. To get a flu vaccine past the Food and Drug Administration in our country, you have to be around 50% or higher. So you can see how amazingly effective these vaccines have been up to now. The other possibilities, as you can see from this chart, the Pfizer, Moderna, and others require 2 doses. Dr. Brooks mentioned this before, as well as I think Dr. Sazzo. But the Johnson & Johnson one, taking a different platform, will probably be a single dose, and that can be advantageous for a lot of reasons. There's also advantages to some of these other vaccines when they become available, AstraZeneca and Novavax, in terms of being stored in normal refrigeration instead of the freezer, which Pfizer and Moderna need. As I mentioned, the data is spectacular. These are 2 articles in peer-reviewed journals that talk about the effectiveness of the Pfizer and Moderna vaccine. And they're part of the reason, undoubtedly, but we still don't know for sure, but we think it's because of this new messenger RNA technology. Again, I'll speak to you in a moment about that. Clearly, there's greater effectiveness. There are definitely safety advantages by just the fact that you're not actually getting the virus, but something similar to it that causes the antibodies to develop. And also, importantly, shorter manufacturing times has really led to the vaccines being rolled out in spectacularly short amount of time. This was also because when the development process of the vaccines was begun, Pfizer and Moderna and all the other manufacturers really started to manufacture on risk, taking the chance that they would work, and they were right. That's why we have these vaccines available now. They are shorter, they're easier to manufacture, and that's certainly been a help. And here they are, the COVID-19 vaccine, both from Pfizer and Moderna. They're available through the EUA process, the Emergency Use Authorization process. And AstraZeneca could be the next in line, although J&J may be available soon as well. I want to say, not speaking as a physician, but as a person with a pharmacological background, that if you're going to get the vaccine, please make sure that you consult with your doctor before you get the vaccine itself. So what does the vaccine do? Let me show you real quickly how these work. Essentially, when you get vaccinated, you're given a small amount of a harmless form of the disease itself. What that does is it helps your body to create antibodies that then fight off the disease. So you now have antibodies present. When you encounter the virus itself and you have the antibodies, what that does is it allows those antibodies to neutralize, if you will, the virus, so you don't get sick. You have immunity. To summarize, what vaccines typically do is mimic the virus. They activate the immune system to develop antibodies without actually getting the disease itself, without being having the opportunity to have the disease. This is a model of the novel coronavirus, and I highlight it because if you look here, these are the crowns of the virus, and these are considered almost like spikes.
Se consideran como puyas.
And thus the name corona, crown to the virus. Viruses surprisingly are the most abundant life forms on Earth, but they're really not alive until they enter the human body and they come in contact with the cell. These spikes, though, are what give it the opportunity to bind to the cell itself. It's almost as if they hook on to the cell. And it's great. It's really important to understand it, because if you can figure out a way to not have them develop, then you essentially make the virus ineffective. And that's what these vaccines have been able to do. So let's look at the messenger RNA vaccines and how they work. What scientists were able to do was they were able to crack the genetic code of the virus. They did this very, very quickly. Why? Because they had messenger RNA vaccines in mind based on previous pandemics, both SARS and MERS. I can tell you more about that later. What DNA does, it stores all the instructions for making everything that the body needs. scientists were able to manufacture a piece of that genetic code called messenger RNA. These are essentially the instructions for the cells to make the spike of that virus. And what they did was they created that by giving the messenger RNA, they create these proteins or antibodies which are able to neutralize the virus in this manner. So messenger RNA basically creates a message to the body to manufacture antibodies specifically against the virus spike. Why is that important? Because you never actually come in contact with the virus. You simply come in contact with a piece of genetic code. And that's really what makes these vaccines so different from traditional ones. At the end of the day, when you take the messenger RNA vaccine, you're vaccinated. If you come in contact with the virus, they're essentially neutralized and you are protected. Here's what it does. It essentially wipes out that spike. By wiping out the spike, you neutralize the virus. It's fascinating platform, fascinating technology. So messenger RNA itself is not new. It's been studied for more than a decade, and it really started with SARS back in 2002, and also specifically really took off when MERS came on the scene. Middle East respiratory syndrome started in the Middle East, and vaccines were really being developed against MERS using the mRNA technology. So when people say it's a new technology, I don't know if it's safe, that's not the case. It's been studied for a very, very long time. COVID-19 is new. Coronaviruses are not new. We've known about them since the 1960s. The common cold is a basic type of coronavirus. So the technology is not new. As I mentioned before, they don't contain a live virus, so you don't carry any risk of causing the disease when you vaccinate someone. And importantly, messenger RNA never enters the actual cell, so you have no ability to interact with the person's DNA. And that's a common question that people ask all the time. The most important attribute, of course, is that you are immune. You have immunity against COVID-19. What about what it actually does to the body? Well, COVID-19 is new, coronavirus is not. And what makes COVID-19 so difficult for people to understand is that some people get a mild to no symptoms, they're basically asymptomatic, and others get severe illness fighting for their lives in an ICU unit. The illness is easily spread from humans to humans quite easily. For a number of different reasons. And the actual name of this is SARS-CoV-2, severe acute respiratory syndrome. It is a respiratory disease, but it affects every single major organ system in our body. It attacks initially the lungs and causes pneumonia. It then can attack the brain, stroke, seizures, inflammation, and brain fog can occur. It also can affect the eyes, causing conjunctivitis, eyelid, membrane inflammation, and also the nose, causing loss of smell. I have one colleague who was infected back in March and still has no sense of smell whatsoever. Your heart and blood vessels can also be attacked and cause clots, heart attacks, and inflammation of the heart. Several athletes have been found to have myocardial or myocarditis, an inflammation of the heart, very, very dangerous for athletes or anyone else. The liver and kidneys are also impaired and damaged due to COVID-19. And then the intestines as well. Nausea, vomiting, and diarrhea can be very, very prevalent in people who are sick with COVID-19. COVID-19 has highlighted what we should have known all along, that racial disparities have existed in our country for years, and COVID-19 has revealed the ugliness of what our society has been essentially either naive about or not aware of. And Black Americans are dying and being affected more than 1.5 times their share of the population. And Hispanics and Latinos, the same thing. They too are significantly dying and having severe illness much higher than their share of state populations. And just listening into the WHO meeting the other day at a COVID-19 briefing, they too presented the same data around the racial disparities that exist in our society. The inequalities now confirm that people of color absolutely have continue to bear the heaviest burden of COVID-19 in terms of hospitalizations and deaths based strictly on their share of the population. And why is that? Well, there's been a racial bias in healthcare since day one. This has existed for years, and now we know why. The racial minorities typically don't have access to testing for COVID-19. They often live in multi-generational homes or live in high-density apartments. They typically live in urban America where they're exposed to pollution, which is not going to bode well in terms of a lung disease like COVID-19, or at least it starts out in the lungs. Oftentimes, either because they don't know or have not been adequately treated, they may be dealing with a pre-existing condition. And typically, while people like me have been able to be hunkered down at home, these folks, Black, Latinos, Hispanic Americans, have been on the front lines with our nurses and doctors every single day. Our grocery workers, our police, firemen, taxi cab drivers, bus drivers. These are the essential workers. And there has been this racial disparity that has been going on with them for years. And that's what COVID-19 has uncovered. People have asked about the new mutations of the virus. Well, there are 3 so far, with more on the way: UK, Brazil, and South Africa. Why do viruses mutate? They simply adapt to evolution. They want to survive as well. And as they mutate and create more genetic diversity, they adapt. And that's how they create these variants. We don't know how contagious these variants are. We don't know if they're more lethal than the present ones. We know the present virus is very contagious. Could these be more contagious? We know about the lethality. God forbid these be potentially more lethal. But here's what we do know. If you stop the spread, then you can impact the amount of variants out there. You can decrease the mutation rate and decrease the amount or impact of these variants. So wear a mask, stop the spread, stop the impact of the variants, slow down the mutation rate. Less virus equal less variants. Now, people have also said, if I get vaccinated, why do I still have to wear a mask? Well, it's really quite straightforward. Vaccine effectiveness is not 100%. It's 90 to 95%. That's not 100%, so you could still be infected. And while studies have shown that the vaccines prevent you from getting the symptoms of COVID-19, they have not shown that you could not pass the virus on, although if you did, it would be more likely at a much lower rate. But you could still pass the virus on. Our studies have not confirmed that even when you're vaccinated, that you can't pass it. So that's why you need to wear a mask for these 3 reasons. And that was a quick snapshot of those slides. Thank you very, very much for your attention.
Thank you, Dr. Claire, really for giving us this educational presentation. I think that we really learned a lot more in detail, and this basic information about the vaccine really gives us a better perspective of what really to look into. And also the fact that you mentioned that we need to make sure to consult with a doctor before getting to a vaccine. So thank you so much. Again, wear a mask and stop the spread. Good message. Thank you so much for this valuable presentation you've given us. At this moment, we will start our discussion and our questions with our guest speakers. And we're going to start with, I have a first question here. I'm going to ask Dr. Joan Sazzo. The first question I have here is, are there any medical pre-existing conditions that we must consider before deciding to get the vaccine? like asthma, high blood pressure, or diabetes, among others?
Yes, hi. That's a great question. While everybody, eventually will get the vaccine over 18 years of age, we know that there are certain medical pre-existing conditions that make the COVID much more dangerous to some people than others, and those being the ones you mentioned, hypertension, diabetes, in particular, obesity, or some of those things that we do see. So those people that have those pre-existing conditions should definitely, with consultation with their physician, be getting the vaccine because they are at higher risk for bad outcomes from this disease. So definitely, those are the people in that group that we'd like to see get the vaccine sooner rather than later.
Thank you very much. That's one of the very high questions that we've been getting as well, so thank you. The next question I have is for Stephen. Stephen, first question I have for you is, how has being a critical care nurse in the front line affected your perspective on COVID-19?
Hi. So I've been a healthcare worker for about 10 years now and an ICU nurse for 5. And I can say it's been very humbling seeing all these sick patients coming into the ICU over this past year. A lot of them, as Dr. Claris mentioned in his PowerPoint, are coming in with this multi-system failure, problems with their lungs, problems with their liver, the kidneys. They were having strokes, having heart attacks. And, we haven't seen anything like this ever in our lifetime. And it's been very scary working in the ICU. At the beginning, I think there were many of us that didn't really know or weren't really sure what this COVID was going to bring. But it's been sad to see how quick patients get sick, and then they get sicker, and then they get sicker very quick. And then that these patients are coming into the hospital alone, and it's the last time they see their family members once they enter the hospital. We're not allowed, a lot of hospitals aren't allowing visitors into the ICUs or even into the hospital themselves. And so patients are dying alone. The stories that you hear in the media that patients, they're dying on ventilators and with nurses holding their hands and zooming into the patient's room. It's all true. And it's been very sad to see. And it's very difficult as a ICU frontline worker.
Wow, that's very emotional for you to share that because, you see it firsthand, and having to live that experience must be really heartbreaking. Thank you for being here and sharing that experience with us. That really reflects on us really taking care of ourselves, our family members, by really wearing our masks, keeping our distance. And so thank you so much for that insight. My next question I have is for Maria Jornawalam. What are the barriers you experience while trying to obtain the vaccine for your parents?
Well, me trying to get the schedule the vaccine for my parents, that's a barrier within itself, right? They're 81, and it's very difficult for them they can't navigate a computer system. They don't even have a computer. They have a smartphone, but they don't know how to use it. The language barrier being another one. The registration process, being chaotic. So it's, I think it's that the panic that we're already in and the urgency that we're in, that we feel like, they need the vaccine right away. It's an added stress level to what's already, it's, like I said, it's really frustrating to navigate the system. So, for senior citizens or for anyone who doesn't have access to this, then it's really difficult. I mean, if my parents didn't have me and my sister, we were pretty much on different, we were taking shifts. Like she would check one day, I would check the next day. It becomes like a second job just trying to get, them scheduled. And I know the state is doing as much as they can. I know the county is doing as much as they can. But I think the advocacy has to continue, and not just getting through these barriers for registration, but getting the vaccines, and people's in the doctor's hands so they can put it out there. So that was it was a tough experience. I'm very blessed that they were able to get the vaccine, and then the whole process once you're there, that's another level of anxiety. You're on a line waiting to get the vaccine, and it's very, everybody's anxious. You know, I was happy to see a familiar face there. We see Dr. Eisenstein on TV every day. So it was, you know, kept them busy in conversation. But again, there's a lot of barriers. I think the vaccine has been out for over a month. So we need to, you know, to ramp things up and try different things, you know, to make it easier for everyone, not just for senior citizens, but for everyone. I know everyone's frustrated with the system and how it's going. So that was my experience.
Thank you so much. You really touch a lot of very key points. You know, a lot of our seniors, they don't have any computers, so they depend on their family members. So, you know, they're very fortunate to have somebody to do those things for them. And the language is another key factor you've mentioned. So thank you for really sharing that experience. I know that they're not alone in the process and the stressful situation, but, you know, I know that New York State is doing everything they can to really get this vaccines, you know, from federal government to the communities here in Nassau County and Suffolk County. So thank you so much for really sharing your experience. It really, you know, makes a difference that we're not alone, that we are all experiencing the same thing. So thank you. At this moment, my next question is for Dr. Pigat. The first question I have here is, does Suffolk County plan to open up their own vaccination center?
Yes, we've been vaccinating since the week of January 4th. The initial partnership we had was with Northwell Health. They happen to be what's called a vaccine hub. So they are supposed to pretty much know what's going on in terms of the amount of vaccines available for Nassau and Suffolk counties. But we already had an agreement in place with Suffolk Community College. And so our base of operations for giving vaccines was the Brentwood campus of Suffolk Community College. So we started January 6th, 7th, 8th, and 9th, and we did about 2,500 or so vaccinations that week. And then gradually, we have been on our own. We receive a certain amount of vaccine from the state on a weekly basis. We generally find out on a Sunday evening or a Monday what we're going to get for the week. For this week, we got 2,700 doses. And so we're distributing that now between Suffolk Community College and Brentwood. And also now we're doing the East End, the Suffolk Community College campus in Riverhead. We've scheduled vaccination sites. And the Suffolk County Police Department is taking the lead in vaccinating law enforcement, fire, and EMS, so first responders. And they've been doing that as well. To date, we've given close to 12,000 total doses, somewhere around 11,800.
Wow, very impressive. Thank you so much. Not many people are aware, you know, the amount of locations available throughout the county, you know, in Suffolk County specifically. So thank you so much for sharing that. And I think, you know, we have some information as to how to go about it to get those appointments to Suffolk County people that live there. So thank you so much, Dr. Pigat. So the next question I have, it's for Dr. Claire. And the question is, if different vaccines are based on different clinical trials in patients, how should they be compared in terms of relative safety and efficiency?
Yeah, thank you for the question, and it's a good one. I think that they can compare very favorably, as a matter of fact, because regardless of the platform that these vaccines come from, I talked to you tonight about messenger RNA vaccine. The other vaccines will probably be using a different platform. At the end of the day, they still all do the same thing. They stimulate your immune system to activate antibodies against the virus. So it doesn't matter kind of how you start, you'll still get those antibodies developed and you'll still be able to stimulate the immune system. There's no reason to think that different vaccines are going to cause a different effect. And I can draw upon my experience in clinical trials for drugs and biologics, where the same thing holds. There are numerous clinical trials that are conducted on various medications. And what they do is they take advantage of diverse populations. So in these clinical trials, and this is what happened in the vaccine trials and will continue, you're having people of great diversity enter those trials, young, old, different ethnicities. And that also gives you experience to think that any drug, biologic, or vaccine is going to essentially do the same thing. Now, granted, different demographics may respond differently, some better than others. Different side effects can occur, sometimes with different subgroups of populations as well. But for all intents and purposes, I think that the comparison of different vaccines based on different clinical trials is still going to weigh out very favorably in terms of being assured about the two most important things, their safety and their effectiveness.
Thank you so much. So, you've mentioned that both vaccines really serve the purpose and that you will still, do the same thing and that it develops the antibodies. So thank you so much for giving us those details when it comes to this question. Now I'm going to go to the second question for everyone. And I'm going to go in order again. So we're going to go with Dr. Sazzo. Second question is, how is COVID affecting children and young adults?
Hi, this is a very, very important topic to me as a pediatrician. Luckily, as we know how dangerous this virus is to people in the older age groups and can be very dangerous to children, and luckily that is an extremely rare circumstance. Generally, children who get this, and in my office right now, we're seeing large numbers of positive, kids testing positive. They basically get very, very mild symptoms. And some of that has to do with the receptors in their body that would allow the virus to be more severe. And luckily, children don't have as many of the ACE receptors, as we call it. As we get older, we develop more of them. So for the most part, and again, it's not zero, children generally get through this without any major issue, and up to 85% of them are actually asymptomatic. What we do see, we have to be careful of, is there's the inflammatory syndrome that's been in the news quite a bit. It's the MISC, the multi-organ inflammatory syndrome in children. It's very similar to another syndrome we see in kids called Kawasaki's disease. And that seems to go around the same time of year. Luckily, we've only had about 100 plus cases, some in New York and nationally. And generally, getting it early, seeing the symptoms early, the treatment is very successful. To get this syndrome, and we tell parents this, the children have to have had previous COVID. They're not going to get this if they didn't have the disease. Once they have it, typically we look for a rash and prolonged fever after they've already recovered from the disease. So once that happens, we tell parents, look, be very, very vigilant. Watch your children. If you see something you don't like, a rash, particularly strawberry tongue, bloodshot eyes, rash on the body, and high fever after they've recovered for some time from COVID, please get to your pediatrician, your healthcare provider, because we can treat this if we get it early, and we can prevent a lot of bad outcome.
Wow, this is very important to know, really, because, we really sometimes don't think about the children, but they really do get affected, even though they have the mild, symptoms. So thank you so much. So parents, we have to be very careful and really keeping an eye on our children. So thank you so much, doctor, for sharing that wisdom with us.
Sure.
So the second question for Stephen Jordan is, why do you feel it's important for the public to consider receiving the vaccine after all your experiences?
It's a great question. There's been a lot of misinformation out in the public that people are reluctant to get the vaccine. But, seeing severe cases of COVID on a regular basis is very concerning that people are willing to take that risk, because no one knows how the coronavirus is going to affect them per se. Even mild COVID can be more severe than the side effects of receiving the coronavirus vaccine. And you don't know exactly how long it's going to affect you. There are people who've been saying, who got the disease back in March and still don't have a sense of smell or still feeling short of breath. We do know how safe the vaccines have been, and we know how successful they have been at preventing the disease. So to me, I think it's important that they get vaccinated. You have to think about it as another tool that we have, like wearing our masks, staying 6 feet apart, washing our hands. It's just another tool that we have to fight this disease. So yeah, that's kind of my take on that.
Wow, thank you very much. Again, it's something to be concerned about, and just prevention is really key. Again, I keep on hearing, keep your distance, wear a mask, wash your hands. Thank you so much. We have to really be very vigilant in everything we do and very careful. So thank you so much, Stephen. So the second question I have is for Maria Jordan-Wallam. The question is, what are your parents' physical symptoms after receiving the vaccines? After that experience, do they have any kind of symptoms?
No, they actually, thank God, they had absolutely zero symptoms. After like day 1 or day 2, they were asking me, are we supposed to be feeling anything? Because we don't feel anything. And so they've been very lucky. This was a while ago now. They don't remember which arm they even got it in anymore. And now they're scheduled for the second dose. And, it's the anxiety is starting to kick in again because, we didn't feel anything for the first dose. Are we going to have any symptoms for the second one? So it's kind of educating them again and reminding them again, you're going to be fine and it's going to be okay. But, it's the anxiety I think everybody is feeling, and we just have to continue to listen to host these webinars, continue to educate the community, and continue to explain, what the vaccine is, how it's made, and try to take away the fear, that so many people have. So, but they're doing fine. Thank you for asking, Lucia.
Very nice. Thank you for sharing. Again, that's good to know, that there is no symptoms and everything went smoothly. And, in the fact that you said that we need to educate ourselves to have more of this kind of webinars and educate ourselves. So I'm really grateful to have this remarkable guest speakers to really be sharing your expertise and your wisdom. So thank you. So the next question, second question I have is for Dr. Piguet. And the second question is, what efforts has the Suffolk County Department of Health Services taken to ensure the public is educated and aware about the facts of COVID-19 vaccines? And there's a second question to that. So I don't know if you want to answer that first and then go to the second one part.
Yeah, we have these forums such as the one we're on now. We do calls with the media. We do press releases. We have a website, and we're always trying to be proactive in terms of getting the message out in terms of the safety and the effectiveness of the vaccines, and really encouraging people to take their shot. That's a campaign that we did to get everybody to take their shot. So that's a hashtag, and it's on the county website as well. And we field a lot of calls. A lot of calls come through our Suffolk 311 system and also directly through the Department of Health with people looking for information. And particularly on how to get the vaccine. In terms of our role, we have very strict instructions by the state of New York. We are only to vaccinate what they call essential employees in the category of 1B, meaning fire, police, EMS, other first responders, and other essential workers, corrections, grocery store employees. And so we have very strict instructions. So I know there are a lot of folks that are, particularly the seniors that are very frustrated in terms of getting the vaccine, but the state has deliberately said that that is not our target group to vaccinate. So, yeah. You muted yourself, Lucia.
I'm sorry. Thank you. So I think you answered the question, but I'm going to ask again the second question, B, because you might have something else to add. So the question is, what are some of the barriers or difficulties that the department has encountered? And you just mentioned a couple, but if you have anything else to add to that.
The main one is lack of supply. We could vaccinate at a faster pace than we have, but we have very limited stock. Originally, we're getting 500 or 600 doses the first couple of weeks we were doing it. It's only this past week where we got anything close to what we asked for, 2,700 doses. That was a lot that we get, but whatever we get through within a week. It's very important that we don't waste any doses and that it's a state policy. They call it use it or lose it. That if you don't use your weekly allotment, then they're going to reduce what you get the week after. So we never want to be in that situation. So, so supplies is the issue, and just having strict instructions on who to vaccinate, that will be the other barrier.
Yeah, it's very crucial, really, not to have one vaccine go to waste, because there's so many people still not able to get it. So thank you for doing that. And the fact that you had the campaign, to make sure that people do get vaccinated, and you're very proactive in really getting the word out. So thank you so much for sharing that with us. I'm going to now go for the second question, Dr. Claire. The second question we have for you is, what is the likelihood of reoccurrence of COVID-19 for a vaccinated patient?
Thank you for your question, and it's a good one. There have been reports in the literature about reoccurrence. So it is not zero. If you get vaccinated, it is possible that you can get a reoccurrence. Why would that be? Because the vaccines that are currently approved, they're not 100% effective. They are 90 to 95% effective, a spectacular effective rate, but still not 100%. So there have been, as I mentioned, reports in the literature about reoccurrence. The other thing that I think about, and again, being a researcher, but not a physician, is that I wonder if it's possible that the people who get a reoccurrence, that possibly when they got vaccinated, that it could have been that they were in fact infected, and that even after the vaccination, the infection reoccurred. Now, one thing that we could also think of is that if the reoccurrence were to happen, clearly, because you're vaccinated, the rate of infection or the severity of the infection would undoubtedly be much more minimal. It would not be as severe if you were not vaccinated. So the fact that you've been vaccinated, you get a recurrence, it's possible, but the severity of the illness, the severity of the infection would undoubtedly be much more minimal than if you had not been vaccinated.
That's very important. You mentioned that. So it is very key to know that, it is much less minimal. So that's always something positive to really consider that. Thank you so much, Dr. Claire. Now we're going to go to the last question for each one of you. And the question, I'm going to start in order as well. Dr. Sazzo, the question I have here is the Nassau County Medical Reserve Corps actively recruiting for volunteers at this time? If so, who can volunteer and how should they enlist?
Yes, we are always actively recruiting. That's a given. Anybody really? We take people with medical experience, EMTs, nurses, doctors, paramedics, and then we have ancillary personnel that would be doing more clerical, stocking, supply, and things like that. We welcome all people that are interested in applying. You could go on the Nassau County website and look up the Medical Reserve Corps, and there's an application there that can be filled out and submitted. Andy Simone is our emergency preparedness liaison. Wonderful person, she's great, and we would like to get as many people in. We're up over 400 members now, and we have almost 500 doctors. Actually, closer to 1,000 members, and 400 of them are physicians. So we're able to mobilize quickly, and we mobilized out for the H1N1 epidemic, setting up our point of distribution pods, and we're doing the same eventually as the product becomes more available. We'll be opening up more pods for the COVID vaccine. But yes, please, if you're interested, please apply.
Oh, wow, that's good news. Thank you for sharing that. I'm glad we asked that question so people could always look back to Nassau County website and look under Medical Reserve Corps. Thank you, Doctor, for sharing that with us. Now, for Stephen Jordan, the question we have here is, what were some symptoms that you experienced after receiving the vaccine, and how do you feel now, if any?
Feel great. I was lucky enough to get both doses of the Moderna vaccine. I was in the first group, I think I got the Moderna vaccine shortly after it was released and approved by the FDA. And, you know, there's always concern being one of the first people to get the vaccine. I remember going back and forth with my wife, but we both decided that's better to get the vaccine, you know, less likely to get the long-term effects. After my first vaccine, I really didn't notice any side effects. I think I had a sore arm that lasted maybe a day or two. And then I got the second dose of the Moderna 4 weeks later. And that was, that's been 2 weeks ago now. The day I got the second dose of the vaccine, I felt fine. And really, I didn't feel any symptoms until about 12 hours after getting the vaccine. And then I got some low-grade fever. I think my temp was 100.5 Fahrenheit. Sore arm, muscle aches, and some weakness, but and a headache. But you know, that lasted for about a day. I had the day off, so I just sat on the couch, watched some TV, and then the next day I was out again, feeling great. We went for a 3-mile hike in the woods up here in Maine, and we had a great time. So, you know, very minimal side effects. Everything is as they've predicted. So there's been really great reporting, and I was very happy to get my second vaccine.
Wow, that's very nice. You know, so now we know what to expect, really, you know, what could be some side effects, and, you know, not to panic. It's very minimal. So thank you for sharing your experience. Now I'm going to go to Maria Jordan-Wallam. The last question I have here for you is, you know, since you had COVID, you know, how has recovering from COVID affected your perspective on this pandemic?
You know, recovering from COVID is very important, right? That statement in itself, that I was able to recover. Unfortunately, we lost a couple of family members to COVID, and I know, you know, some friends and just a lot of loved ones who have been lost. So just the fact that I am here and speaking and I'm recovering, it didn't change my perspective on the pandemic, because I already knew it was a serious pandemic, but it made me try to speak up more and to speak to others more and to try to educate others, you know, on the importance of us doing our part. I unfortunately can't get the vaccine yet. I don't qualify, but you know, while I was sick and trying to get through COVID, it's the only thing that kept on coming through my mind when my parents, you know, if they need to get vaccinated. That's what I kept on telling myself, like they have to get vaccinated because they won't, I was, you know, afraid they wouldn't be able to recover from COVID. So again, it's just, you know, that's the perspective of the pandemic, is just spreading the word, educating ourselves with facts, you know, not just asking a friend of a friend of a friend, but actually, you know, asking questions to doctors, you know, not just going online and Googling all the information that we want, but actually getting factual information on this, and just continuing to do our part, you know, wear a mask, social distance, wash our hands. And if you can get a vaccine, you know, definitely get vaccinated. And again, that's, you know, very, very important for us. I think that's the only way I think we can handle this pandemic.
You know, thank you. You mentioned that, you know, recovering, that you were very fortunate. Very few people have been fortunate, and, you know, we have lost many family members. But the fact that we've experienced that, I think that, you know, we now know really how serious this is, and that we really need to take care of ourselves. And when you said about, you know, educating ourselves and make sure you contact your doctors and make sure that you're advocating and speaking up and letting people know that this is something serious, and that we're blessed that you have, you know, experienced this pandemic and the COVID, and you were able to overcome. So, you know, that's really something, and very important to realize that we need to take care of ourselves and do our part. Thank you so much for your answer. The next question, I have a last question for Dr. Pigat. It says, besides all the emotional and social economic implications related to COVID-19, We also have a parallel disease of misinformation or mistrust impacting our community. What would you say to those who are concerned about the safety of the vaccine, mortality rate, or health issues after receiving the vaccine?
Trust is something that needs to be earned, especially in communities of color. You know, you can't be someone who's unknown, someone's coming from the outside, and immediately people are going to trust you and trust what you say. So it's important to build up, I would say, a cadre or an army of trusted messengers in communities of color. You know, in terms of Suffolk County and dealing with communities of color, I've done a lot of work in terms of programs and people getting to know me over the years. And I'm hoping to put that to use as we go out and as we really start getting the harder to vaccinate populations. So that's important to have trusted messengers, people who have gotten the shot and have done fine. And you can say, hey, I see that you got that shot a month ago. Did you have any side effects? You know, are you seeing double? Or, you know, you having issues keeping food down, anything like that? It's like, no, I feel totally fine. You know, and so just enough people in the community who have gone through the experience and who have come out on the other side. And you know, one of the important things you have to say is that I've seen people who've gotten COVID and unfortunately did not do too well with it, but anybody I've seen who has gotten the shot is doing totally fine. So people have passed away from COVID who have not passed away from getting a COVID shot. So it's important just to say that this is the way out of the pandemic.
Yeah. Trustworthy, yes, respect, right? And it's very important. People see you as an honest person, so they know they could trust you. So thank you so much. Earning that trust is very key and very important for people to really listen to you. And thank you so much for all the wisdom and really doing everything you can to let your community know about the importance of really getting vaccinated and taking care of yourself. So thank you, Dr. Pigat, for really sharing that experience with us. And the last question I have for this session is for Dr. Claire. So it says, some people with COVID-19 can have very mild symptoms, and we talked about that. So many see natural infections as preferable to receiving a new vaccine. Others may be concerned that getting a COVID-19 vaccine could make a later illness worse. Is it better to get natural immunity rather than immunity from a vaccine?
Yeah, thank you for your question. Oh, I think that is clear that you don't want this virus. And I think our participants tonight have emphasized that throughout. This virus can be very, very severe. As Dr. Sazzo alluded to, while young people typically have less severe symptoms and may go asymptomatic or may be relatively mild, they are still having severity, as Dr. Sazzo alluded to, and there have been deaths reported in young people, granted not many, but still this can be a very, very severe illness. And as Dr. Sazzo mentioned, the illness can exacerbate through an inflammatory response that people can't predict. There's some biomarkers that physicians can look at that might give you an indication that this patient may not do well. Obviously, the pre-existing conditions that have been alluded to by the physicians on this panel tonight, and they've mentioned that, being elderly, having comorbid conditions. But getting the vaccine, you don't get the virus. So you will not experience what could be the severity of this infection. And we haven't talked about the long haulers, been mentioned a bit, but some of these, as we know, some of these infections just persist. A colleague of mine for over a year now, loss of smell. So you don't want natural immunity by getting the virus and developing your immune response that way. You want the vaccine to give you your immunity, develop the antibodies. So if you encounter the real thing, you're protected. That would be clearly much, much more preferable. Do not diminish the severity of COVID-19. That is a big mistake.
It's very powerful. Thank you so much. Sorry about that. Thank you so much for really sharing that with us. So, you know, we've been really privileged and honored to have you all here with us answering our questions. So much wisdom, so much knowledge, and we really are grateful for each one of you to really have taken your time to be with us. Thank you again for answering those wonderful questions, and thank you for all your response. At this moment, I will pass the mic to Melody Janza, who is going to go to the next part of this presentation. Thank you so much, Stephen, Dr. Claire, you know, Maria, and Dr. Pigot, and Dr. Claire. Thank you so much for really being here with us.
Thank you, Lucia, and thank you to all our panelists. I just wanted to provide some information about the distribution plan, how to find out if you're eligible and qualify for the vaccine, and some updates from the federal government as well. So there is a list on the website that you see below. We also will share the link on our chat box. There are various groups and fields that qualify for the vaccine, as you can see here. The list is ever changing and being updated. So I do recommend that you go on the website and see if you are part of these groups that qualify to make an appointment for the vaccine. Additionally, New York State does have a COVID-19 vaccine tracker. This is updated every day at 11 a.m. So as of today, 11 a.m., 1,475,122 people have received the first dose. Additionally, 369,186 people have received the second dose, and between Long Island's first and second doses, 231,041 people have received the first and second dose so far. So the federal government determines how many vaccines New York State receives, and as of right now, we're only receiving about 300,000 vaccines per week for the entire state, and that includes 7 million people who are currently eligible. So unfortunately, supply is very limited, as our guest speakers have mentioned, and you can receive the vaccine through pharmacies, hospitals, local health departments statewide. So be sure to contact your provider of choice to schedule your appointment. Additionally, there is a network of state-run sites that are distributing the vaccine statewide. To determine your eligibility, you do have to visit the MI Eligible app, and I'm going to briefly go through what that looks like and how it works. But you do need an appointment. You cannot just visit any of these locations and try to get a vaccine. Unfortunately, like I said, the supplies are very limited, so it's based on appointments first. So I'm just going to go through some instructions on how that works and what the page looks like. You want to visit mieligible.covid19vaccine.health.ny.gov, or you can call the number 1-833-697-4829 to determine your eligibility. So here, you just want to search up the website, and then it'll provide you the areas and the locations that are available from New York State. You have to enter your date of birth, sex, whether you live in the state of New York, and if you work in the state of New York, and your zip code. And then it'll just ask you some questions about your employment, whether you work in a healthcare facility, first responder agency, corrections agency, etc. So for this example, the person applying was a grocery store worker, and you will then be prompted to select a time and a place for your appointment. As I mentioned, supplies are limited, so right now many of the locations will show up as no appointments available. Unfortunately, you do have to check in every so often to see if an appointment has opened up. So here there is an appointment available in the International Airport at Plattsburgh. So you'll be able to choose the day that you want to do it, how many vaccines are available will show as well, and also the proof and identification that you need to bring before arriving for your appointment. Then you just choose the time for your appointment, and it will then ask you for personal information such as your address, email address, phone number, additional information such as your date of birth and gender, and then you'll be able to schedule your appointment. So after that, you want to make sure that you complete your vaccine form. The form should be filled out online, and you will receive a submission ID indicating completion. You will need to bring the submission ID to your appointment. If you cannot submit the form online for any reason, you can do it at the vaccination site while you're there. The website to find that form is displayed above, and we will also include it in the chat box for you to save. The third step to preparing for your appointment, you want to make sure you have your proof of eligibility for your appointment. So it depends on your eligibility category and what field you work for, but it could be an employee ID card, a letter from your employer or organization, a pay stub, driver's license, passport, any legal proof of your date of birth and residency. At the time of your appointment, you will be asked a series of clinical questions to ensure your readiness for the vaccine. And you may be asked for your insurance information, but the vaccine is free and there will be no charge to you. This is strictly for administrative purposes only. To receive your second dose, typically the appointment is scheduled at that time, and it will be 28 days or about 3 weeks after your first dose. So this is some information for Suffolk County. So Suffolk County, if you receive the vaccine in Suffolk County, the county will be contacting all the persons who have received their first dose of the vaccine, and they will provide them with the information on how to obtain their second appointment. And this will happen approximately 1 week before the second dose is due. This is dependent upon the county receiving sufficient vaccine supply, and just be sure to make sure that you're answering any phone calls or texts or emails from Suffolk County to make sure that you receive your second dose on time. Again, more information on the website displayed above at suffolkcounty.ny.gov/vaccine, and you'll also find the link in our chat box. For Nassau County, if you receive the vaccine in Nassau County, you will also be contacted from the department. If you received your vaccine in Nassau County Community College, the Yes We Can Community Center, or the Union Baptist Church, you will receive an email that contains a special link to schedule your second dose appointment. And that will it will be at the same place that you received your first dose, and typically it will be 28 days after your first dose. If you already received your first dose of vaccine from Nassau County and believe your information should be in their system, please email the email address above and include your first name, last name, phone number, email address, date, and location of your first dose. And again, more information on the website, nassaucounty.ny.gov/vaccine. I wanted to also share some initiatives that the federal government is taking, such as the pharmacy program for COVID-19 vaccination. Starting February 11th, those eligible for the vaccine will have the opportunity to be vaccinated at select pharmacies across the country through federal retail pharmacy program for COVID-19 vaccination. This program is public and private partnership with 21 national pharmacy partners and networks of independent pharmacies representing over 40,000 pharmacy locations nationwide. Some of these pharmacies that will be included and will be facilitating with this program will be Walgreens, CVS, Walmart, including Sam's Club, Rite Aid, Costco, retail, business services, including Stop and Shop. If you would like more information, we're also going to be showing that link in the chat box, and you can read more about the news press on that. New York State also is doing an initiative to ensure that those in long-term care facilities are receiving the vaccine. Through this, employees of CVS, Walgreens, and other pharmacies will be vaccinating residents and staff in long-term care facilities, including nursing homes, much like they do for the flu vaccine. This program began December 21st, 2020, and so far 600 nursing homes across the state are participating in the program. And now I'm going to kick it off to Joe. He's going to take us through our Q&A session. So thank you.
Hi, folks. Thank you, Melody, and thank you, Lucia, for leading this terrific discussion. And I want to thank all of our panelists as well. We have some great questions that have been submitted by our live audience, and I'd like to get to them. So I'll be addressing them both directly to one or more of our panelists who the question is related to, or I'll be just throwing out to the panel in a general fashion. Dr. Sazzo, I'm going to actually start with you with this first question, just because I know that we spoke about this briefly earlier. Should someone still get the vaccine if they have tested positive for having antibodies?
Yeah, yes, absolutely. I'll take personal experience. I had COVID back in March, mild disease, luckily. My antibodies are still through the roof, and I just completed my second dose a couple of weeks ago as a first responder. I will tell you, yes, the antibodies you have, we don't know if the innate antibodies that we have from the disease are neutralizing enough We do know that if you have the disease, you're pretty much immune for at least 90 days after your acute infection. But beyond that, then we can't guarantee that you'll be protected. So yes, antibodies right now, number one, are not considered good proof of immunity. And if you have the antibodies and it's been more than 90 days from your infection, or if you've never had it, by all means, please, yes, you need to get the vaccine.
Thank you. I'm actually, this is a sort of a specific question, but I think can definitely go out to others who might relate. And I'm just going to throw this to any one of the three medical personnel that we have, doctors that we have on the panel here. We have someone that's basically saying that his mother is 85 years old. She takes thyroid and glaucoma medications. Will that in any way, affect her should that in any way affect her taking the vaccine? Dr. Claire, is that something you can speak to, or?
No, I have to say, being the non-physician on the panel and more of a researcher scientist, I would defer to the physician,
Gotcha.
Piggott, Dr. Sazzo.
Yeah, hi, it's Dr. Sazzo. No, there is no contraindication that we can see to taking those medications. There really is, other than not getting a different vaccine within 2 weeks of the COVID vaccine. Medications do not affect the vaccine's effectiveness.
Thank you, sir. I'm going to direct this next one to Dr. Piggott, but I'm also going to open up to other panelists after the fact. Doctor, there's several questions just asking about vaccine accessibility, and obviously people are expressing their frustrations at being able to, logging in but not being able to get appointments unavailable, that type of thing. Can you speak just from your position from the county perspective in dealing with the state a little bit about the process itself of how, of distribution and perhaps alleviate some of the lack of information on how and when these might be the different types of opportunities might present themselves? All right, I see we're having a technical difficulty with Dr. Piggott. Dr. Sazzo, I know perhaps you can address this. I know you work with the Nassau County version of this, so maybe you can address this for a moment.
Yeah, sure. Just if you just want to re-summarize the last part of that question.
A lot of frustrations out there about just availability, right? So basically, you log in, you're doing everything you're told to do, and basically you're told nothing's available right now. So you try the next day, you try the next day. Wondering if you could possibly speak to, how these, sort of how distribution is set up and allotted, and what we're dealing with obvious limitations.
Right. Yeah, we've been dealing with this for quite a while. New York State basically controls the flow of product that they get from the federal government down to the various agencies that'll be distributing it. The only thing you can do really right now, and again, we're dealing with 1A, 1B categories to get their vaccine. You have to constantly log on, and appointments will open up, at least on the Nassau County DOH. We have our pod at Nassau Community College, and we constantly are adding appointments as the product becomes available. That's the big issue, is that we are, as the slide alluded to before, we have 7 million eligible individuals in New York State and enough product to last maybe about 4 days. It has to constantly come in, and we're very rate limited on giving it out. We have the mechanism to give it out, but we don't have the product to give it out. So the best thing I can tell people is please keep looking. The websites you put up before are excellent. Look anywhere you can if you're in that category, and keep searching, because those appointments will open up on a daily basis, and try and get into it. The biggest issue right now, like I said, is that we're limited by products. As more products hit the market, hopefully the Johnson & Johnson will be the next one. They just actually applied for their emergency use authorization today. Hopefully we'll get expedited approval by the FDA. That again adds now another level of product available on the market. So hopefully we will be able to do that. But I know there is frustration. I see it every day. We're a registered practice to be able to give the vaccine to adults that are eligible, and we haven't been able to get product from the state. So once it's available, we will start definitely giving it out.
Thank you, sir. I appreciate that. Let's see what we have next. So, 1 second. All right, here's actually a great one that I'm actually going to speak to briefly, and then I'm actually going to turn it over to Lucia because as the senator's constituent, director of constituent services, she has, I mean, we all have, but she has been on the sort of front lines of dealing with this on a daily basis. So considering the difficulties finding appointments, what is an option for people without internet access or computer savvy to sign up for the vaccine? And how are people who are homebound going to receive their vaccines? I'm going to quickly say that we are in the senator's office. This is just one response. We are doing outreach. We are, taking phone calls and working with people that do not have computer access or anything like that. Honestly, we're walking them through it on the phone, right? And we're doing it for them. We're doing outreach to seniors, in the population, as well as anyone else who might, direct that outreach in that regard. But I'm actually going to turn it over to Lucia to respond to this, please.
Thank you, Joe. So yeah, I've seen a little bit of everything with the COVID vaccines with phone calls. Many instances, if people don't have a computer, I will make it a point to make sure that I go into the website and I will try to make the appointment for them if there's anything available. So we're able to do that. If somebody doesn't have a computer, we're trying to make sure we contact senior centers just to let them know the services that we're offering for those seniors that might not have any social media or any internet access to. They could always call the office and we could try to see how we could help them when it comes to this particular issue with appointments. I also, people sometimes ask for information. Where do I go for this? I have a list of different links and phone numbers as to county government, if it's Suffolk or Nassau County, and I will send them that information so they could go ahead and try to see if there's any appointments available. So we try to give them as much resources as available that we have so they could look into it themselves, so we could try to help them with that appointment process if there are any available. Joe, you're muted.
My apologies for the delay there. Thank you, Lucia. And actually, I'm going to throw this over as well, maybe in a more sort of general aspect.
Ahora vamos.
Hold on one second, please. To Dr. Sazzo, again, from a county-wide perspective, perhaps you can speak to this a little bit as far as people that don't have, computers.
Right. This is, again, we have phone numbers that could be called, and you had them up on your information before. Yeah, this is, the system, unfortunately, we're in that type of day and age now where, you need a computer. It's like not having a telephone. We say you can call it the eligible, there's the 800, the 1833 number there. You can call and they will walk you through and help you register through that. Again, there's going to be long lines, obviously, because there's going to be a fair amount of people that don't have computer access or have iPhone access to do that. Eventually, we will get people through and get everybody registered as it comes in. But don't be discouraged and keep pushing. That's the best thing I can tell you. Keep calling.
Thank you, sir.
Sure.
I can honestly say that, from the perspective of the senator's office, we're constantly fielding phone calls and we are doing our best to reach out to people who, may not be able to have that type of digital internet access. But I will say that it's a difficult prospect. So we would definitely encourage you to let people know how to reach out. There are different phone numbers. There are different ways. We ourselves have worked directly with people who don't have internet access to get them in, to get them scheduled and registered. We can even help with directing people towards rideshare information. And I'm actually, just for a second, I'd like to just take a moment and turn the cap off this particular group of questions with Maria Jordanwamo, because I know that she works very closely in communities that that tend to be marginalized and closed off. And I'd like to sort of just let her give a personal perspective on what access means in those areas. Maria? right, I guess we're having a little technical difficulty there. Okay, well, we'll get to that in a moment. I will, yeah, I think there's some audio issues going on. So we'll just move on to the next question, but we will get back to that. Here's a great question. And again, I'll send this out to any of the doctors, but what is the best mask to wear, and does facial hair interfere with mask wearing?
I can probably attest to the facial hair since I'm fully bearded here as a nurse in an ICU. Yeah, facial hair can interfere, especially with the N95s. I've been on vacation for the past 2 weeks, so I've just let it grow out for while I can. In terms of masks, N95s are probably going to be your, all the masks have pros and cons to them, but have an N95 here. They all have their drawbacks. This is probably going to offer you the most protection, but it's probably the most uncomfortable to wear. And if I put it over my face, then you got to squeeze it over your nose, and it's very hard to wear for prolonged periods of time. A lot of times people drop their mask down below their nose, and that's not going to do you any good. You got to make sure that your nose is covered. And then a lot of masks that people are wearing these days are facial coverings or cloth coverings, and having a couple of different plies in terms of thickness is going to help them. I think the best bang for your buck, and I don't know if the doctors would agree with this, but is the surgical masks, and making sure that you're sharing them, not reusing them too many times, and that you use a new one every day.
Yeah,
Thank you.
I would agree with that. It's a three-ply surgical mask is typically the best one and least expensive and most comfortable. And just as an aside, as you mentioned, what people are wearing different masks. Masks with exhalation valves on them, which make it easier for you to breathe, or basically negate the whole effectiveness of the mask. Even though people say, oh, they have filters in them, they don't work. You're basically bypassing the mask and blowing your germs right out. So please avoid those masks. But a typical three-ply surgical mask for day-to-day use is fine. Just don't reuse it too frequently, as you said. The N95 is best, but hard to breathe through.
And Joe, I wanted to weigh in on this as well. I've gone to the double mask manner, and have been using a double mask for now probably several months. And again, it's just the same issue as just mentioned. The more protection you have, the better. Double masks, a little bit more inconvenient, but I feel more protected. And I think there is some data that would support if you can't get an N95, double masking can offer certain advantages, provided, as you mentioned, they are over your nose and covering your mouth. But I am now in the camp of double masking.
Thank you all. Thank you all three for those answers. Dr. Claire, I do have a question for you. Actually, someone looking for a little clarification on something you spoke about earlier. When you mentioned, that it's a good practice to seek out a physician to speak to you before you get the vaccine. What about someone who does not have a regular physician? And the clarification is, are you suggesting that an individual should find a doctor before getting it? Absolutely, or can you expound on that?
Sure, I'll start with the question and then defer over to the physicians on the panel. I do think it's important, even if you don't have a healthcare practitioner immediately in your orbit, that you seek out a physician prior to being vaccinated. And here's the reason why, and it was alluded to throughout the evening. If you have an underlying medical condition, then you should that should be discussed. And as was mentioned, there aren't any contraindications to taking the vaccine. And everyone has said the same thing in the medical field: get vaccinated. But still, you should have a baseline of what's going on with you. Even if it's a walk-in medical clinic, to come in without an appointment, those are typically, you're able to go there without an appointment for the most part. talk to a physician. I'm getting the vaccine at Jones Beach the day, 2 weeks from now. I really want to be checked out for some basics, or just talk to you about this situation. I really would encourage the American people and anyone on this call tonight to, prior to getting vaccinated, talk to a healthcare practitioner just to be assured of the way to move forward. There are side effects that were mentioned that can be severe. And if you've had a history, for example, of anaphylaxis, then a physician should guide you as to how you should approach the COVID-19 vaccine, because that could be an issue for you. If you've had the flu vaccine and you've had a side effect that was untoward, such as, again, respiratory problems, or even breaking out in subtype of hives, et cetera, that is something that you should talk to your healthcare practitioner about. So again, the answer is, please see, I would encourage everyone to seek out a medical person, a physician, prior to being vaccinated for the reasons I just mentioned.
Thank you, sir. I think that was a very well expounded upon response. If anyone wants to add on to that, great. If not, I will move on. We do have a couple more questions here. Let's see here. Okay, so there's several questions actually that are just asking about the priority of senior citizens. A lot of people just aren't clear or aren't sure, or they've heard different things as to whether or not the priority is people 65 and older, or if that has been sort of diluted in some way, shape, or form. Is there anyone here that can speak to how that's working out right now?
It's Dr. Sazzo. Yeah, I mean, what had happened was, we know that as you approach 65, the risk of disease is much higher. The risk of bad outcome is much higher. So the 65 and over is what's been approved in New York State now. That was a big change that happened a couple of weeks ago, where we moved people from the 1C category to 1B. So more the seniors, basically anybody 65 and over is eligible. That is the highest risk group. It does increase as it goes up. We have about a 0.8% risk once you cross 65. That goes up to over 1% as you get into the high 70s and early 80s of age. So yeah, no, I mean, basically 65 and over in and of itself is enough of a risk factor that warrants getting the vaccine as soon as possible.
Thank you, sir. I have a question here basically asking, hold on, sorry. If you have a compromised immune system, does the Johnson & Johnson vaccine, is that a better scenario to wait for that?
Well, the Johnson & Johnson vaccine is different from the mRNA vaccines. It uses an injured the chimpanzee adenovirus to be able to spread the DNA. It's a DNA virus into the cell. It works similarly to the mRNA. It kind of goes back a few steps further. That you'd have to discuss with your physician. Because it is an attenuated virus that's transporting it. There could be potentially some issues with immune issues. The Pfizer and the Moderna vaccine, being the mRNA vaccines, just have what we call a lipid coat on them, which is basically a layer of fat. So we don't generally see immune issues or triggering of the immune system with that untowardly. So that's something definitely that should be discussed with the patient's physician.
Thank you. All right. So if let me, I mean, we addressed this earlier, but I'm getting I'm getting a couple of different questions. If you had COVID already, and I do know that this was addressed, but this is a recent question that came up, so perhaps it's by a newcomer. But ultimately, could you give us just a quick response on, do you need to be vaccinated if you've had it already?
Yes, to repeat that answer, yeah, absolutely. Again, you want to wait. If you recently had it, you have to wait 90 days from the time of your recent infection before you become immunized. And not because you'll get sicker with the vaccine, but the vaccine may not work as well because your own antibodies will interfere with it. But as I said, in my case, where it was almost a year ago, and you had the disease, yes, you need to be immunized because our own innate antibodies don't last long.
Thank you, sir. So last question before we move on, and there's just general question I'm going to throw out either to Dr. Sazzo or or whoever. But let's see. Basically, when will the vaccine be readily available to the general population? Obviously that's a matter of numbers, but can someone give a quick response to that?
Yeah, hi, it's Joan Sazzo. That typically would be category 3, which is general public, anybody without any risk factors who's 18 and over. Ideally, we initially are shooting for late March into April. I would say we probably have to push that up a little bit further into April, maybe late April, early May, just because, again, the supply issue. But as hopefully more of these vaccines come online and more product available, that number will come back down again into April.
Thank you, sir. One last thing, we do have our audio issues fixed. So I'm going to just readdress the question I asked earlier to Maria to just give us a sort of a first-hand account with the communities that she lives, works, and is involved with as far as access to accessibility to the internet and different different ways, and just sort of give us an idea about that in regards to how can people who don't have internet access or anything along those lines to register.
Sorry about that before. So I think COVID made us learn different things, and we had to change a lot of things, right? And we have dependent a lot on social media and on just doing everything online. And I think we have to get creative in how we disseminate information to all these communities that we know are already having a difficult time getting information. So I don't know, I've heard so many times about the pop-up locations. Maybe we need to have pop-up locations in these areas that we know are highly at risk of getting COVID, and we need to access them in a different way. I mean, not all these people, not everyone is on social media, not everyone's online, not everyone has computer access. Unfortunately, libraries were closed for a long time, so that made it difficult, where people used to depend on the libraries also to use computers. So I think we need to just show up and have these clinics, and also do testing again. It's not only about the vaccine. People still want to get tested. People are still, not everyone has access to the vaccine, so they need to be tested for COVID, and that information has to be out there as well. So providing information for the free testing, providing the same sites that we had before for testing, I think that all has to be accessible to everyone, and continue ensuring that we have language access for everyone, and just continue to advocate and continue putting the information out there as much as we can. There's never enough that we can do with information out there, so we just have to continue to share as much as we can, and putting information out there.
Thank you, Maria. And just so you folks out there understand that Maria is an integral part of our the Senator's work group on outreach, and helps us organize these webinars that we do twice a month. And we asked her to present herself in public today because of her unique perspective in the community, and I want to thank you for that. Folks, I want to thank everybody here for helping us out and offering their their expertise. I am going to turn it back over to Senator Brooks to just give us a final farewell. But first, thank you, Melody. If you look on your screens right now, you'll see all the contact information for Senator Brooks. For his office, please, any questions, issues, problems you're having, please reach out to us via email, via direct phone calls. We have Spanish-speaking staff members who can easily, take calls from people for whom English might be an issue. Please let people know that. And thank you, Senator Brooks, over to you.
Thank you, Joe. I'm really sorry I wasn't able to be involved with this all night. We got dueling Zooms going on, but I did have an opportunity to hear some of the questions and answers, which I think is great. I know all of you are concerned. I know everyone in the medical profession is doing everything they can to make these vaccines available. I think it is very, very important that we get that done. As was said earlier, there are some additional vaccines we think will be available soon. That's all good news. In the meantime, you know, let's make use of the mask. Let's make sure that we keep our, pardon me, our social distancing. Don't gather in large groups. Just be smart, but be cautious. People are still getting sick. People are still passing. We're getting to a better position, but we're not there yet, and the numbers are way too high. The number of people we've lost in this country is way too high. But let's learn from this too. Scientists and the medical experts have found their way through this virus, at least with the vaccines that we think work. They're giving you guidelines that make sense. There was discussion on use of the mask, doubling use of the mask, the value of shaving, maybe. No, I'm just kidding with that one. But, you know, I also think we need to give a big thank you to our educators, particularly in our public schools, because they have made sure that the kids in school are using the protections and keeping the social distance. And, you know, the results they've had, the limited infections in some of these schools says a lot for the work they've done to make sure our children are playing by the rules. I know with my grandchildren, they have their masks on and they understand. So it's one of these cases. Sometimes we learn from the kids. The kids are playing by the rules. We all as adults have to do that. I hope this was helpful to you all. We are going to continue to make available any information we have on the availability of vaccines and the local sites. Certainly we see at a national level, there's been a much more, especially for lack of a better word, dedicated effort in expanding and getting the supplies for these vaccines. That is a very good thing. I again want to thank everybody that participated tonight and the expertise that they bring and what they do all day long, working with people and making sure they're getting the medical treatment and assistance that they need. So this has been a tough battle. You know, we're closing in on a year. We're closing, unfortunately, into almost 500,000 people have been lost. You know, we got to stay together. We got to stay tough. We got to stay smart. And as was said, you know, when people are contacting and it's tough for them, we're trying to make connections for those. You know, I think in the neighborhoods, if you know you have people that are tough to travel and stuff, if you can help them out in that way, it's helpful. And you know, take time to remember those that have been lost and to appreciate the absolute heroes who have been on the front line on this in so many different ways. And the medical doctors. I had to go to the dentist the other day, and my dentist introduced his son, who is also a dentist. But during the height of the pandemic, he was working in the hospital in the cardiac unit, trying to help people. So our medical doctors and nurses and all the rest have really stepped up to what's out there, put themselves at risk, you know, they deserve a big thank you. And so to those of you that are here tonight on the webinar, I say thank you so very much for all of your efforts and what you do. Having worked in emergency management for a long time, and when you do disaster planning, pandemic was always the big one, but you hoped you'd never see one. We have. And while we could have done better things in some areas, we're getting organized. We're getting the vaccines out there. We have people, professionals that can tell you the real truth on the disease and things you should take into consideration. So I hope you learned something tonight. For my staff, I thank you once again for these webinars. You know, they do a great job finding experts that are available and, you know, making the system work. And it's incredible, the spread of these things. I don't know how many people will end up being on this tonight and the follow-up ones, but it's an opportunity to reach out to people and give them information. And I think that's our job, listening to you and then giving you information you need. And, you know, and people have tough times. Lucia was saying that she tries to register them. That's what we're trying to do. If we all pull in the same direction, and when somebody falls, we help pick them up, we'll get through this, and we'll be a better place when it's done. So thank you all for joining us tonight. To those of you who participated directly in this program and my staff as well, I thank you so very, very much. And